Alright, so this is my second journal entry, and I've been going through my practice on that NEO for a while now. So I'm just going to go over the daily, well, what a normal day for us is. Well, I get in there at 8 o'clock, and we have two doctors of physical therapy and three PTAs that are working at the same time. Each tech basically gets their own PTA, each therapist gets their own PTAs. Each therapist gets their own PTA, each PTA gets their own tech, which is what we are. So basically, we get assigned to a PTA of the day. We have a patient list. We take patients from 8 o'clock, and our last one's 10:40, so we get out of there at 12 for lunch, and we get back at about 1 o'clock and work till about 6. So basically, our job as a tech is they'll call the patient out over the intercom. We have to go pull their flow chart, which will tell them if it's a shoulder, knee, what kind of procedure they had. We got to let a lot of post-op people because we're orthopedic. So basically, the flow chart's already done from their initial evaluation from the therapist. So all we got to do is pull it out. We go get the client or the patient, kind of talk to them, see how they're doing, how they did over the weekend. Then we start them out on the exercises. If it's a knee, we usually go warm them up on the bike, or if it's a shoulder, we'll go warm them up on the UBE bike. And basically, what we do as a tech is we run them through their workout correctly, so the exercise can be beneficial in a therapeutic way. And that's our job, to kind of keep on them for technique and form and work them out. And once we get done with them, then they'll go to the therapist of the day and get stretched out. They'll get stretched. If they need any soft tissue work, they'll do that. Any manipulation, they'll do that. And then modalities. Usually the therapist will do, if there's a need for any ultrasound, they'll do the ultrasound. Any kind of anti-inflammatory cream they'll use on them, they'll massage it in. They have to do all the soft tissue. The modalities that we can do as techs, we will hook them up to vasopneumatic compression, which is for swelling and pain management, and we can hook them up to ice and stim. The type of electrical stimulation that we use for the ice and stim would be IFC, which is interferential current, sends across electrical current. That's for pain management as well. And then after they're done all the modalities, they're usually basically done after whatever modality they have, and we'll go walk them to the table to tell them when they need to reschedule and how many times a week they need to come see us. So that's a basic rundown of the typical work day. We get tons of patients. Each therapist usually has 30 patients a day, so we stay busy, and it's just kind of organized chaos up there, but it's been a real nice experience. It helps out a ton to be able to visually see the therapeutic exercises and all that. It's a whole lot easier understanding isometrics when you're watching it than reading it. Like, we have 6-way isometric for shoulder patients. We got flexion this way, and extension, and abduction, all that good stuff. Internal rotation, external rotation. It's so much easier to understand, especially isometrics, when you're watching it. But there's so much stuff that I've learned other than isometrics, obviously, but I'm just saying that's a great example. Hip isometrics too, squeezing the ball with your knees, adduction, abduction, putting the belt around the knees and pushing against the belt. That's a good way for isometrics and hips. Also, another great thing, the modalities are really cool and interesting to learn about. Vasopneumatic compressor, IFC current, There's Russian current. There's so many modalities. Rolling people, rolling muscles to stretch them out. It's really cool stuff. But that's just a rundown of a basic day and what we do. So there you go.